and welcome to our conference here at the CMTO. We will be presenting to you barriers to exercise in people with Parkinson's disease. And I'm Amy.
I'm Caitlin.
And I'm Sasha, and I will be starting off with what exactly barriers to exercise are. So these include anything that do not allow a person to participate in physical activity, and can include physiological, psychological, environmental, economic, or access to resources. Ellis et al. Explain what barriers are for individuals by using the International Classification of Functioning, Disability, and Health model. So this includes the person's health condition or disease, any things that inhibit them from participating in an activity, their individual body structure and function, as well as environmental and personal factors. Parkinson's disease is a chronic progressive degeneration of the basal ganglia, which affects motor control in the central nervous system, and it has been linked to the depletion of dopamine. So there is a classic triad of symptoms in Parkinson's, which include tremors, rigidity, and akinesia. There's been a high level of depression found in patients with Parkinson's disease, which can be linked to the decrease in dopamine levels in the brain. And people with PD can become deconditioned as they have difficulty carrying out functional activities at the levels that they are used to. There is no cure for Parkinson's disease, but research has shown that exercise can help the individuals in managing their symptoms.
Okay, so now that we've looked at what barriers to physical activity actually are and what patients with Parkinson's disease, what their symptoms are, and what the disease itself is, I'll discuss some of the present research that's out there as to the barriers themselves that people with Parkinson's are facing. So in an article titled Barriers to Exercise in People with Parkinson's Disease, Ellis et al. 2013 discussed that low outcome expectations to exercise itself is a barrier. So with that in mind, it's just that people really aren't aware of when they are exercising how positively it can impact their life. It's also stated that lack of time was a reason why people weren't exercising, and fear of falling. In a second article titled Exercise and Neuroplasticity in Persons Living with Parkinson's Disease by Hirsch and Farley in 2009, the barriers to exercise in patients with Parkinson's disease are listed as physicians' lack of knowledge. So they're not telling their patients, or exemplifying, focusing on exercise itself and how important exercise can be in treating the symptoms of Parkinson's. Self-efficacy, so the person themselves doesn't have the personal motivation to include, and the self-esteem levels to incorporate exercise in their daily activities. The symptoms themselves make it difficult to exercise. The lack of access to Parkinson's disease specific community-based exercise programs make it difficult. Outcome expectations once again, and the cost to participate in exercise. And then the third article that we looked at, a study of perceived facilitators to physical activity and neurological conditions by Ellsworth et al. 2008, state that lack of disability awareness and among fitness professionals is a major barrier to their exercise regimes. Limited condition-specific knowledge in healthcare practitioners themselves. So this is why it's really important as a future RMT to be aware of exercises that can really help your patient. Again, decreased self-efficacy, so their confidence levels and motivation isn't quite there to encourage exercise. Barriers from the health condition itself, so again, the symptoms causing inability to exercise. Lack of energy, fear of falling, negative effects with exercise, so maybe some increased muscle soreness, preventing them from adhering to an exercise regime, time constraints, difficulty moving about in a public space. Often people's medication affects the timing of their exercise session, so because it's very specific as to when they need to take their medication, it interferes with their ability to incorporate exercise into that part of their day. And then another one which I found interesting was that the swimming pool temperatures are often too cool for patients, so by the time they're not able to move fast enough to heat up their body. So although swimming is a great exercise for people with Parkinson's, if it's too cold, they're really just not going to do it. So a fourth article titled Factors Associated with Exercise Behavior in People with Parkinson's Disease, Alice et al. 2011. The barriers to exercise in patients with Parkinson's disease were listed as personal factors. So maybe some family members aren't encouraging exercise, or there's other factors getting in the way. Self-efficacy again, educational levels. So it stated that people who are more educated were more likely to exercise. And then older age. I did find this interesting because I would have thought that although this factor, old age, was not statistically significant, I perceived that younger people would be more likely to incorporate exercise, but it's actually older people who were more likely to incorporate exercise to treat their symptoms. And then finally, in a fifth article that we looked at, titled Physical Activity Behavior Change in Persons with Neurological Disorders, an overview and examples from Parkinson's disease and multiple sclerosis by Alice and Model in 2013, state that the barriers to exercise with people with Parkinson's disease are self-efficacy, low outcome expectations, fear of falling, stretching, setting achievable goals, and lack of knowledge with facilitators, so with people who are trying to get them into certain programs. And then next we'll see how we as future RMTs can help.
So this is how we as RMTs can help a person with Parkinson's disease. We can refer a client to a personal trainer who is well informed about their condition that they are dealing with. We can refer clients to support groups to aid them in coping with this debilitating disease. While in our care at your clinic, remedial exercise should be incorporated, as well as balance training, stretching, strengthening training to all major muscle groups. Other exercises that can be prescribed incorporate aerobic exercise, so swimming or walking is excellent exercise to start with. These activities are to be done at moderate rate for 20 to 30 minutes 3 times a week. As healthcare practitioners, we need to be aware of the differences that there will be between clients. When prescribing exercises, it is essential to cater to them individually and his or her abilities to do what they can do. When prescribing strengthening and stretching exercises to your client to help with their self-efficacy, you can get them to jot down where they're at with their strengthening and stretching. And as they're going through their exercises, they'll be able to look back at what they've documented and see the progression, and that will help build their confidence.